From me, I'm Richard Grant. I'm one of the PPI co-applicants along for the Coventry HDRC. Welcome from me. I used to be a teacher in Coventry. My main subject was biology teaching. I did some science as well, but I used to be a county councillor in Warwickshire. So I've got a lifetime of experience. And my main thing about Coventry is that I'm a true bred Coventry kid. So I know quite a lot about Coventry. Over to Jane.
Hi there. Yeah, my name's Jane Whitehurst, and I live just outside, well, just south of Coventry and west of Warwick. Um, and I'm also one of the public co-applicants for the Coventry HDRC. And I've also had quite a lot of experience working with the NIHR in various guises. I've been on the public advisory group of many different projects. And I've also done peer reviewing for the NIHR. So often they send out applications to members of the public sat at home to actually review them. And then I've also sat on funding committees as well. So I've sat on programme grants, research for social care, and research for patient benefit. And I've done a lot of public reviewing for the Health Technology Assessment Funding Committee as well. So I don't know if, Richard, do you want to talk about your experience? Yeah.
Yeah, I've got quite a bit of experience as a PPI person. Much of it has been to do with broken bones and a lot to do with broken hip bones. My dad broke his hip bone while he was in hospital, had it repaired, and it took him ages to recover. So I've followed his care and was involved in consulting about that and how that progressed. So I picked up a lot of information about hip joint fractures and the femur fracture as well. So a lot of my experience has been around broken bones and the follow-on as well, the physiotherapy. I've like everybody's family, in my family we've had all sorts of health issues that I bring to the table, and my work as a teacher and as a counsellor, I've worked with communities, so I can bring those life experiences to the PPI perspective. What we needed to tell you was that we're not experts on PPI and all the pros and cons, but we bring our own personal experiences to this webinar so that we can share those with you. Some of those will you'll probably spot some similarities, but you may have some different experiences as well. But we all, as PPI people, bring our life experiences, because we are expert on our own life experiences, to the table and to the research work.
Yeah. So just to close off this slide, just to say that there is a big variation in both the processes and the application forms used across the NIHR. And the NIHR has a lot of different funding streams. I went through the website, and there are at least 13 different domestic programs, let alone all the global and the career ones and the infrastructure streams. So they try to operate a similar process, but it's not an exact science. So what we're going to give you is an overview from our personal perspective of the applications and processes that we've been involved in, which are broadly similar across the NIHR funding streams, but just be aware that they're not identical. So do you want to move to the next slide?
Just now an outline of the sessions. You can see there in the boxes what we intend to go through. We want to go, what is the NIHR, and about the importance of research, what type of research is funded, who can apply, the research process and bid for applications, and the importance of having the public involved in that process. So that's what we intend to go through. Next slide, please, Michael. So what is the NIHR? Jane has sort of given you a general overview. It's a national institute for health and care research. And I suppose the care has been added lately because the Department of Health was very much on its own at one stage, but now in more enlightened times, care is included in health and care when it comes to the umbrella organisation. It's all government funded. and because the government, whatever shade they are, feels that research is important for health and care, and very often that funding goes for national research projects, but there is an arm, the International Development Fund, which funds research in other countries around the world. We can benefit from that as well. I'm involved with a project with low and middle income countries like Nepal and the Philippines and India, where we're looking at hip research and the care of patients, because the burden of broken hips and the global economy is currently phenomenal, and it's even going to get worse as the world's populations age. You can see that the last point is about the supporting research to improve health and social care of communities. It's all geared up to improving patient health, and the NIHR works across a number of organisations. Obviously, the NHS, it works with universities and it works with communities. Next slide, please. Now we've got a nice little video to show you, which comes from the NIHR, which we find particularly helpful and interesting. So, Michael, the video, please. Well, we hope you found that interesting and useful. One thing that always strikes me is people might think, well, 5%, oh, so what's that? But if you think about it, if you think of a primary school, if you've got an intake of 100 pupils, that's 5 pupils in that year group. And there might be another school down the road with another 100 in an intake, and you can start to see that that can have an impact on quite a large number of children in a school, and those children will grow up in families, and those families will be impacted by the health of those children when they grow up to be adults. So why is it important to fund research? The video made those points quite clearly, but it is finding better ways to treat and care and prevent illness. The NHS is interested in improving its services for the health of the patients and their care. And one of the things is that the NHS hasn't got limitless supplies of finance, but it's making sure that the finances are used as most effectively as possible. Some people confusing that with saving money. No, it's about using the limited resources most effectively. The next point is about making sure that the care decisions are based on evidence. It's no good sort of thinking, oh, well, I reckon that's going to work, this will work. No, you need to make firm decisions based on good evidence to make that decision. And then the last point is about supporting individuals to promote their best possible overall health. That's psychological, physical, and of course that includes mental health as well. So it's supporting individuals as well as organisations. So funding is worthwhile to fund and get good results. Next, please, Michael. Now, the type of research that the NIHR funds, there's a whole list of them there. Obviously, health conditions. We hear a lot about cancer research and mental health research and diabetic research. We don't hear so much about social care research, but quite a lot goes into to that. Dementia is a big area of concern at the moment as the population ages, so we want to make sure that the social care of people with dementia is as best as possible. It's no good thinking, oh, well, I reckon that might work, but it might not. We need to have some good, firm evidence to make decisions. Then there are whole issues around public health. I think probably we're all aware of the diet and exercise, particularly from that little video, and the work that's gone into trying to stop people from smoking and the impact that has on lives of the person and their families and their working lives as well. So that's all important for public health. And then we've got the whole issue about employment and the health benefits of employment, mental health, and the impacts of unemployment on people. So all those are fundings for research that can be worthwhile. And then there's a whole host of work around housing and healthy homes. I know in Coventry there is some concern about people who live in unhealthy homes probably have may well impact on their health. So it's important that housing is considered in research so that we can improve the health of those living in those homes. Next, please, Michael. Now, here's a whole list of things and who can apply for research funding. Obviously, the NHS and social care staff are busily making sure that they're putting in bids for research funding because they want to make sure that their services are as best as possible. And then there's a lot of work that goes on in university with researchers whose career is based around research. There's some excellent and superb researchers working away in universities, often alongside the NHS. Then community organisations such as charities will engage with a researcher to carry out research because of the issues that are around their issue. It may be that it's diabetes, it may be mental health. There's all sorts of things that voluntary organisations are concerned with and are looking for research to improve the lot for their set of people that they support. And the last point, that it's the vital point as far as Jane and I are concerned, that patients and the public are involved in the planning of that funding research, because it's no good some whiz kid of a researcher's thinking, oh, I reckon we'll research that, if it's going to have no direct use for patients and the public. So it's making sure that patients and the public are involved in that planning process. Next slide, Michael, please. Now we've got an example here that we wanted just to introduce you to, was some research that Coventry HDRC put forward, because the whole thing about HDRCs is research, and it's about working with other organisations to get some good research done. This particular study worked with the University of Warwick alongside HDRC Coventry, and the public, we've got a group of people, representative members of the public, which we call the public voice group. They were involved in a focus group to help provide feedback and shape the research plan. It is often possible for the the public to say, just hang on a minute, you've not got this right. You need to make sure that you include this, or don't do that. You need to make sure that it is focused on the real life patients. The public co-applicants are involved in research, and in this particular case there was representatives from the Public Voice Group meeting, and they helped to cost the bid and put the bid forward. They were quite chuffed with their bid and thought that it would get approval, and it was submitted in April 2025, and unfortunately after it was considered it turned out to be unsuccessful. Now that was a big disappointment, and it always is, because many applications do fail, but that encourages people to go back to the drawing board and rethink it and go through a new process and put in another bid that is improved. But I think we've put that in there to show the process, and also to say, well, it isn't just like magic, it all gets approved. We need to be real about these things. It is a competitive process, and sometimes it is unsuccessful, as this case was. Now, next slide, please, and it's going to be over to Jane.
Just as the dogs start barking. Oh goodness. Just hang on a second. Yeah, anyway, I will carry on. Hopefully you can hear me above the dogs barking away in the background. So the first thing in this whole application process of going through with the NIHR is, first of all, you need to actually identify the funding opportunity, and they can be identified in a number of different ways. So you can look at the research funding websites such as the NIHR, and it has lots of different funding streams on its website, and you can look at the different opportunities there. Sometimes if you're looking for funding opportunities outside of the NIHR, although I know this particular presentation is about the NIHR, you can look at other charities such as British Heart Foundation or Cancer Research UK. There are lots of people who fund medical research, public health research in the UK. And they use a language called calls. So when the NIHR wants to encourage research in a certain area, it will put out what it calls a call. And this is almost like a call to researchers to say, please apply. And it highlights the areas that they specifically want researchers to focus on. Sometimes that call, the scope of that call, is quite narrow, and they can be very specific. Like, for example, I was in one call just recently, which actually wanted to look specifically at how public involvement was being used within health research application bids. So it was very, very specific, but sometimes it will be quite wide in a wide disease area. Sometimes the public can actually submit research questions directly to the NIHR. Doesn't happen very often, but it can be done, or they can do it through an advocacy group or through a charity, or they can do it via, say, something like the James Lind Alliance, which canvasses the public and asks the public to help them prioritize areas of research that the public wants research into, and then it will then submit those to the NIHR. So having identified the specific funding opportunity, the researchers then need to develop the research question, and they actually need to decide what it is they want to research within the scope of the funding call that has already been put forward. And so this is, what is the question that we want to ask? What are the outcomes that we want to measure? And then they'll go forward and plan the study. And this will be looking at things like, what are the timescales? What are the budget? What's the team we want to include? What's the methodology that we want to use? So they'll go through a whole planning the study phase, and they'll write up the bid application, which they do by applying online to NIHR funding, to one of the many funding streams that there are available. There are 13 actually that are domestic programs. So there are quite a few, and one of them is public health, but others are things like program grants, for example, which are very much applied research, and they're very much multidisciplinary, multi-stage, often will include a pilot, really big £2.5 million funding programs. You'll then go through quite a lengthy review process. And that it is very rigorous. As somebody who's been involved in that process, I've actually been quite surprised myself by how rigorous it is. Often there's the multi-stage process, which I'll go into in more detail later, but that multi-stage process will involve, for example, applications being sent out to members of the public sat at home. It will be sent out to peers who are similar in stature to the lead applicant for the application. So you will be reviewed by your peers, and then it will go often to funding committees, which are committees of maybe up to 20 people with a whole variation of different skills, and will always include 2 members of the public in that review, in that committee. So that will go through an extensive review process, and then a funding decision is made. And if that is approved, then the research can begin. But just lastly to say, the patient and the public are involved at all stages, whether they're helping, develop the research question, whether they help plan the study, whether they're part of the review process, or whether they're involved once the actual research starts. So that's just a brief overview of the process. Michael, if you just move on to 11, thank you. So, as I said before, you've got different research funding streams within the NIHR. There are about 12 or 13 domestic ones, and they vary from things like health technology assessment, which would be looking at specific technology devices, like a pacemaker or a pump, or a device that a diabetic might wear. So it's like pieces of technology. So that's one particular funding stream. There are others to do with public health. There are the others that are regional, so they're not national. They are sort of regionally funded, and they're looking specifically at patient benefit in that area. So those are the domestic funding streams. And then there, as Richard alluded to, there are some global funding streams. There are also some career funding streams, like ones for early career researchers going on to do fellowships. And then there are infrastructure funding streams, for example, for ARCs or for the HDRC itself. So the NIHR has lots of different funding streams, and the process, as I've alluded to before, differs for each one. But most funding streams have a multi-stage process. They have what's called an outline application, which used to be called stage 1, which is quite brief, and I will go into that in more detail in a minute. And then they have stage 2, which is a much, much more detailed application process, and which will be then reviewed all over again. And just to set the context, the funding process from outline to the potential outcome can range between about 10 and 18 months, depending on the different funding stream that you're looking at. So it can be quite lengthy. And then between, the 18 months and the project actually starting, then there might be another gap as well. Michael, if you just move on. So this is an example timeline. And as you can see, some of the key dates there, the application, the call might have opened, and the application deadline, it might have been, it might have opened in March, sorry, and the deadline might have been in December. So that's giving you quite a long time to apply there. And then you've got a notification of a decline if it's out of remit or non-competitive. So one of the first things that the program directorate will do will scan all the applications just to see that they're actually within the scope, and they might redirect you to another funding stream if they think it's out of scope or you perhaps applied to the wrong one, or if they just think it's just non-competitive and a non-starter, it's either over the budget or the timescales are too long. So having gone through that sort of initial shortlisting, each of the outline applications, or the old stage ones, would be reviewed, and they could be sent out to peer review, they could be sent out to public review, or they could be reviewed in an outline planning meeting or committee. It just depends on which funding stream you're going for. And then, having been successful at that outline stage, you'd be then invited to go to the full application, or the stage 2. And again, you've got probably a 3 to 4 month window in order to get your stage 2 application in. And then it could take another 3 or 4 months, or if not longer, before the application decision has been made, often following a committee meeting. And then you'll get notified. And then, as I said, even if the project has been approved in July, because of holidays and things like contracts that need to be drawn up and things like that, it could be that the project might not even start till December 2026. So from March 25 to December 2026, that gives you an example timeline. Now, the more high budget the application is, the longer it's usually going to take. So the smaller budget projects will probably get funded much more quickly than the longer ones. So next slide, please. Yeah, as Richard said, funding is limited. Many researchers are competing for it. And another piece of language, so when the NIHR put out calls, that within that call they'll have various competitions, and they have competition funding rounds, and they call it competitions for a reason. It is a competitive thing. It's quite a secretive thing, competitive thing. People don't, you have to keep your application quite secret and not share it, because you are competing against other researchers for the same amount of funding. And sad to say, the success rates are quite low. So only about 10 to 20% of the applications are successful within the NIHR. So that means 8 or 9 out of every 10 applications might be rejected, even if the proposed research is quite good. And I've worked with numerous research teams and put in bids, and sometimes they've only been successful on their 3rd or 4th attempt trying to get a particular application funded. And having an application knocked back and having to reapply several times is really common, and a lot more common than you might think. And I've also sat on funding panels where we've had to reject some really good applications, because each funding round, each competition has a very limited number that it can fund. And we all score, as a public member on a committee, we all have to score each application numerically, and those scores are added up. And then we fund from the top score down, and there'll be a cut-off. So you might only be 2 or 3 points below something that got funded. And but if we think the application has got merit and it narrowly missed out, and there may be only a few tweaks to make it a successful application, then often in the rejection letter that you get, there will be some encouragement to reapply again. So next slide, please. So I'm just going to go through a brief overview of the outline application stage and the stage 2. So an outline application has been getting shorter and shorter as my work with the NIHR has progressed. Outline applications used to be up to about 30 pages. Now they're trying to be really quite short, down to 5 pages in some examples. It will always contain a plain English summary, but the detailed research plan won't necessarily have a separate working with people and communities section, which would normally have, in previous years, it would have included how you're going to involve the public. So that's not necessarily a requirement at outline stage anymore. But you need to demonstrate a clear research methodology that's being considered and answer the so what question. That's really, really important. That's how a lot of outlines get filtered in or out of scope, especially at that very, very first stage. So it needs to be within scope, and researchers quite often make mistakes, but there is a lot of guidance on offer from the NIHR. So if you're ever worried about, am I applying to the right thing? Is this within scope? Best thing to do is just to talk to them, and they'll help you, so you don't waste your time. But the next thing is it really needs to answer that so what question. What difference is this research going to make? How novel is it? How different is it from what has been done before? So if successful, the successful applicants will be asked to apply for stage 2 for further peer and panel review. So the real difference between an outline and a stage 2 is, as you can see, an outline might be very short. It won't have detailed CVs or detailed descriptions of the teams. It will have estimated costs, but there won't be a detailed budget breakdown. There'll be a high-level overview of the approach in the research plan and the methodology, but a lot of filtering, a lot of work has gone into making outline as short and as possible. But one of the problems is often you can't convey what you want to convey in an outline. And so often a lot of the feedback from an outline stage application will be provide more detail in stage 2, provide more detail in stage 2. And that is us as peer reviewers, as public reviewers, and as committee members saying, yep, we think this has got merit. We think it's got legs. You look like you're looking to do something quite interesting here. You look like you've got a decent team. The methodology looks reasonable, but you're going to have to provide a lot more detail at stage 2. Yeah, can we have the next slide, please? Yeah. So in stage 2, there's a much higher word count, and you can go anywhere from 15 to 100 pages, just depending what funding stream you're applying for. There'll be a lot more detailed narrative. The budget will be broken down a lot more. You'll have to provide not only a budget for every cost item, but you'll have to provide a justification, a written narrative of that cost and why you think that cost is required. You'll have to provide lots of CVs for members of the team, and you'll have to say, why those team members are important and what they're bringing to the party. You'll have to provide publications, lots of supporting documents. There's a detailed research plan section, which I'll go through in a minute, but you have to demonstrate a robust research methodology, including a specific working with people community summary, which is where you would include your PPIE plan, which is how you're going to involve the public and how you're going to engage with them. Very importantly, your stage 2 needs to address any of your feedback at stage 1 or outline stage. I'm sorry, I still keep using stage 1, even though the terminology has changed. So you need to address all the points that you've been fed back at the outline stage, and any of the questions and the critiques you received, and you need to address those. There's a very, very robust and thorough application process at this stage. So at this stage, it will definitely go out to peer review. It will definitely go out for public review. And it will definitely go to some kind of funding committee. At this stage, you'll be allowed to do things like upload Gantt charts, detailed program plans, your CVs, if you've got any logic models showing how what you plan to do translates into patient benefit. That's often shown using something called a logic model. Any letters of support that you might have from supporting organisation, and any appendices. So you've got lots more scope to add and upload a lot more things. Again, if successful, it can lead to the research funding being approved. Again, you will still almost certainly get back a letter from the funding committee saying, yes, we're happy to approve your stage 2, but, and there'll be a list of things that they still want some assurance on. And so they might ask you to describe things in more detail. And then the funding committee doesn't necessarily sit again, but it will review your answers and things that it's asked for and the assurances that it's sought. And it might query certain costings, for example. And it's only at this stage that the contracts are drawn up, and that can take quite a lot of time. Okay, next slide. So what's in this research plan? So but just to reiterate, before the research plan, you'll have things like at the beginning of the application, things like the application description of the team, of the lead applicant and all the co-applicants. You'll have the plain English summary, you might have a scientific abstract, and then you get into the nitty-gritty of the research plan. And this is going to be, these sorts of things are typically covered. Some of these are covered in more depth in the outline stage versus stage 2, but in general, these are the types of things that are covered in most of the research programs. You'll be asked to provide a background and a rationale. This is your chance to describe what is the health or social care problem that's being addressed and how the project responds to gaps in existing knowledge. For example, why does this research need to be done? Why does it need to be done now? What's the gap in the existing knowledge? What inequalities might you be addressing? Or what needs of underserved populations you might be addressing, or both? You need to sell your research at this stage, why it's important, the need for it, the impact that it could make. And specifically, you need to address things like inclusion. And you need to also address why the existing evidence base is not strong enough and why there's a gap and why this research fills that gap. So then you'll go on to explain the aims and the objectives, what you hope to achieve. You might talk about the outcomes of the research that you plan to measure to show whether research is successful or not. And then you'll go on to the methodology or the plan. And this is the chance for you to really flex your research muscles and describe the project design and the methods, the innovative methods that you're going to use, the timelines and any milestones, how long it's all going to take. There's a whole section and emphasis on working in partnership with those affected by your research. So that could be communities, it could be members of the public. So that's using them as part of your research team. These aren't the study participants. And showing how you have been inclusive in your research. You need to talk about your research team. Yes, you need to say who they are, provide their CVs, but you will also have to justify in a narrative form what they are bringing and why they are particularly needed and why each member is essential to your research. And then there's a new section, which is all about inclusivity. And you really need to show how you're being inclusive right from top to tail, how you're being inclusive in terms of your team members, how you're being inclusive in terms of members of the public that you might want to look at, how you're being inclusive in terms of your exclusion and inclusion criteria, how you're being inclusive in terms of the population and centres and the regional scope of what you're doing. So across the whole breadth of what inclusion means, you need to demonstrate that you're being inclusive. And then there's a whole section on knowledge mobilization, dissemination and impact. This used to be called just dissemination, but the NIHR have realized now that, disseminating from, the inside out, at conferences and writing publications is no longer what the NIHR is really aiming for. It's really aiming to mobilize knowledge, get knowledge into practice and really making an impact. There'll be a whole section that you need to cover in terms of project management, how the study is going to be managed, what are the governance structures, who's included in them. And again, you need to show inclusivity in who's being involved in the project management. And then there's a little section on, well, not little, but I don't know much about it, but it's all about intellectual property and commercialization. So if you do develop anything that's got any IP or intellectual property rights, how can those be leveraged in order that that the NIHR protects its assets when it's funding your research. So if I could move on to the next slide. Yeah, so what really makes a good research application? I think one of the really important things is that it really needs to make a difference. It really does need to answer that the so what question. Why are we doing the research? Why bother? What difference is it going to make? It often, as I said before, needs to be something that's new, that's different, not just an incremental piece of work that's building on previous research. And it clearly needs to describe the benefit and the impact it will have on patients and the public and the NHS. So the application is your opportunity to sell the research. And one of my most often pieces of feedback that I give in funding committees and to when I'm doing peer reviewing, and I'm sat at home and I've got an application in front of me and I'm writing written feedback, is there is often no explicit mention of the benefit of doing research to the patients and the public. You'd be surprised how often it's missed out. Sometimes researchers get so bogged down in the approach and the methodology that they want to use that they forget to stand back and actually explicitly state the bigger picture of what they're doing and why they're doing it. They clearly articulate the problem. Yeah, that's quite clear. And they clearly explain the methodology, but they don't describe the impact that this research will have if it's successful and if the recommendations are implemented. You can't just expect the readers to infer it. You really do have to use your application as a vehicle to sell your research. The second point, it needs to be really clearly written with a good plain English summary. I think this point should be obvious, but it's from my experience, it is not obvious to researchers. And I've reviewed probably hundreds of applications in my time. And I think one funding committee chair summed this up really nicely. He said, "We can't fund what we don't understand." And if you make the language so complicated and impenetrable that people struggle to access the application, then you're going to get a low score because people can't understand it. So a funding application really isn't the time to show off your grasp of, your vocabulary or your grasp of grammar and your ability to string long sentences together with colons and semicolons and what have you. It really needs to be simple. So headings, short sentences, bullet points, white space, simple grammar are often what's needed. The plain English summary is often overlooked, but in all committees I've sat on, every panel member, from the chair right down to the public contributor on the panel, are all asked to provide a review of the plain English summary. So the expectation is that they will read it all. And so they all will provide a critique on it, either written or verbally. And many funding panel members or committee members that I've spoken to have said that they all read the plain English summary. It's often the first thing they read because they're not experts in everything that they're asked to review. The committees are they are, they may have a clear grasp of public health, but they're not going to be a particular expert, for example, in traffic pollution or mouldy homes or anything like that. They are broad generalists in an area like public health. And so they struggle just as much as anybody else to read the application. And the plain English summary enables them to get that high level overview, to enable them to go into the scientific abstract, which often gives them a better stab at it. And then they'll go into the main body of the application. Going on to the third point, a good research application will have a strong team with the right skills. It's really important that you think of breadth of team as well as depth. And often community representatives, people like GPs, physios, charities, the public are often overlooked. So yes, you need strong methodologist, a good statistician, a good behavioral expert, and so on the team. But you also need that breadth that shows this working together partnership, which the NHS is very strong on at the moment. You need the timely involvement of the public, absolutely crucially and ideally with lived experience, but use them wisely. The chances are that if you've managed to find some people with some really crucial lived experience, they've often got health issues of their own. They may be carers. They may have limited time, limited energy. So you need to use them strategically. So use them wisely. You know, lots of people can help you write a lay summary or maybe help design a questionnaire, but not many people have got that lived experience. So, you know, be careful what the ask is of them and make sure you use their time wisely. I'm going to hand over to Richard now, who's going to talk about some of the burden on
Briefly,
participants.
just want to emphasize Jane's point about the plain English summary. That's really, really important. If I get asked to review an application, that's the first thing I read through, because sometimes the skilled researchers or surgeons or doctors use complicated language, which is can be difficult to understand. So it needs to be really, really clear. So to emphasize that point. The second point I wanted to make is that it's this team, and we said we're looking at this from a PPI point of view, and that any person that's like me or Jane involved in research application, we need to be members of the team. We are part of the team, and we bring our life skills and life experiences to the team, and that's really, really important. Next point I want to make is that this lived experience, just a little example, when my dad was recovering from his broken hip, he was given a food drink to take to boost his body so that it could help him recover. And he was given loads of these posh little containers with this food drink in. And I said, come on, Dad, drink them up. And he was very, very reluctant. And I said, come on, Dad. I said, I'll try one. And they were horrible. And I can understand. I mean, that's just a silly little example, but it was very important because I learned a lot. Because another project that I'm involved in is looking at the nutrition of patients recovering from hip fractures. And we need to have real life experience of what it's like, because if you give them something that's unpalatable, it's no good giving it them. I ended up having to put a load of those food pots down the loo because I couldn't get rid of them after my dad died. But that's just a simple example of how we can be involved from our PPI point of view. The other thing is that the burden on the participants. I was asked to be involved once in a project to do with blood circulation, and I was asked, said, look, you'll need to go to have a blood test once a month, and that's all that's involved. Oh yeah, but in where I live, you have to make sure that you can book an appointment at a Dracula clinic to get your blood taken, then that's quite a difficult process and get there. So it needs to, if you're going to involve the public in the research of the patients, it's got to be, the burden has got to be as light as possible, and you've got to have thought it through very, very carefully. I did review an application recently where they'd thought through very carefully what the patients were going to do and how they were going to deal with it all. Now that made for a good application, and I was able to support that, so they know what they're doing and know what the burden is on the patients. I think we're ready to go on to the next slide, please. And this continues what I've just been saying, that about the importance of public involvement in research. It keeps it relevant to real life. As I've said previously, we are experts in our life experience, and we bring that to the table. Researchers that are very skilled, and they're very skilled people, they know what they're doing about research, but sometimes inadvertently they forget the real life experience and it gets missed out. And so we can, as part of the team, we can say, look, this is important in people's lives, in patients' lives. This is what's relevant. So make sure that your research is about that aspect. The important here is about improving the quality of the research. I think everybody would agree that we need the research to be of the highest possible quality. We don't want poor quality research because that will give you poor quality results. So the PPI people with their lived experience can ask better questions, ensure that the methods are clear and the results are useful and going to make a difference to patients for their care. And then the next point is about making sure that there is trust in the process, because I think we've all seen some examples in the past about research that's come out and people will say that's a load of rubbish. Anybody with a bit of sense would not support that. So the emphasis these days is making sure that when the research results are out, they can have the trust of the public, that they know that it's sensible research, it's based on real evidence and a thorough examination of all the issues and carefully worked through. So that trust is really very important. And the final point there is making sure that the results are understandable. It's no good having a highfalutin sort of presentation to the public and in a press release that nobody can understand, that journalists are stabbing around making up their own stories about what they think it's important. So we need to make sure, you need to make sure that the results are clear, unambiguous, easy to understand, so that anybody reading them, journalists, member of the public, anybody can understand what it's been about and what the research findings are, so that benefit to the patients is spot on and really good. Next slide, Michael, please.
Yeah, so on this one, we just want to do a quick whistle-stop tour around some of the areas, some of the public contribution and what that might look like at different stages of the research life cycle. So right at the beginning, the public could help actually shape the research idea, help prioritize it, help define the research question, help define the outcomes. Often researchers want to define outcomes in things that are very researchy. A classic one that's often given, it will be, levels of, redness for eczema and things like that. Whereas, an outcome for a patient might be things like, I want to be able to sleep through the night. So those are so real world outcomes are things that matter to the patients. Whereas researchers will be measuring, specific blood levels or levels of particular chemicals or things that are they're not related to real life. So using the public to help define outcomes, and especially secondary outcomes for research papers, is really good. So as I said before, public applicant can help write the research bid. Both me and Richard helped write the HDRC funding application right at the beginning. They could do peer reviewing at home, and they could be members of funding committees. The other thing they can be involved in is steering group type activities, like trial steering committees, or very, very commonly public advisory groups. That's the sort of generic term that's used, a public advisory group, which might have between sort of 12 to 15 or sometimes 20 members on it, which will be helping work alongside the research team. And we've particularly given a name to ours called the Public Voice Group within the HDRC. During the research, they might be actually helping to actually conduct the research. They might do things like help write public-facing materials like topic guides or interview guides or information sheets, public information sheets. They might help write the actual questionnaires or as I said, topic guides and things like that. They might help influence and shape the research as it goes on. For example, they might review the results and think, that does those results make sense? Is that what I was expecting? Is that completely out of line? And if it is out of line, why might that be? And you always bring something new and different to the research by always challenging and asking questions and saying that doesn't feel right. And sometimes there can be problems with the research. So you might be helping with troubleshooting. There might be problems with recruiting enough participants to the study, or we might be finding that there are a lot of barriers to people participating, and we need to understand why. And sometimes the public, people in the public voice group or the public advisory group can help unblock those problems and help provide a different perspective and help actually solve some of those problems. And then the last two points are really about making sure that the findings are translated into things that are usable to the public. Things like, if we're going to do summaries, let's make sure they're written well. If we're going to write articles, let's make sure they're understandable. If we're going to go to conferences, let's make sure that the public are involved as well. We might want to do videos or share case histories. Let's make sure that they're well read, well written. So we help in a lot of ways to make sure that the findings are translatable and can be used by the local population. So those are the things. That's just a whistle-stop tour of some of the ways that the public are involved in research right from the beginning to the end. So I think we've come to the last slide, which is basically any questions. I know we're kind of short on time, but we're welcome to stay on and take any questions anybody might have.